massage nurse. This is part 2 of the pathologies of the nervous system. So I'm going to be talking about migraine headaches, multiple sclerosis, Parkinson's disease, sciatica, seizure disorders, thoracic outlet syndrome, and trigeminal neuralgia. So let's hope that I can make it through without any interruptions and without any mistakes. This is my third attempt, guys, of making this video. I've had all kinds of setbacks, but let's see how this goes. So let me start first with migraine headaches. Migraine headaches can be, from just mild to severe to incapacitating, where the client can't even leave their house. There are many triggers for migraine headaches, and you can talk to your client about this. It can be anything from hunger, from carbs, from chocolate, from red wine, bright lights, loud noises, stress, hormones. So you want to be, catering to your client if they come in while they're having a migraine headache, that you turn down and dim the lights and you don't have like a candle or any sense going on, or even your oil, because it might really make it worse. Now, what I have found in my experience is that most people do not come in while they're having a full-blown migraine. They come in either right before it starts or after it's gone, because when it's incapacitating, they really don't even want to go anywhere. They just want to be, at home in a dark room, dark, cool, quiet room. So one of the things that I do recommend to my clients is menthol. If they have any menthol, to rub on their temples, on the occipital part, or even in the anterior part of their neck, behind their ears. The menthol, the smell reduces the nausea, and it starts calming the person down. And also I ask them to apply some cold compress, like even just a washcloth with cold water, and just put it either on their forehead or on the back of their head. It prevents sometimes the pounding of the blood flow, on their temples. One of the things that you want to make sure if they do come in for you to work on them is that you work the suboccipitals, which, remember, the suboccipitals are known as the ghost headache muscles. So you want to make sure and work the suboccipitals, the whole scalp, and even gentle circular motion, the SCM, the upper trapezius, the rhomboids from the shoulders. You really want to get all of that. It helps a lot with the stress, especially when it's caused by stress. So other than that, you just make modifications according to how your client is feeling at that moment, depending on if it's just the onset or, if it's already after they're sore. That's another thing that I do notice, is they're very sore after they've had a migraine. Everywhere you touch is very sore. To try to keep it light and accommodate to your client's needs. And I have found that massage therapy helps tremendously with migraine headaches. It really does. I've had clients that if they come in regularly every 2 weeks, they don't have migraines anymore. So that's something to recommend to your clients too. So next will be the multiple sclerosis, and that's a degeneration of the myelin sheath of the around the nerve. And I brought you guys some examples. I always feel that you guys learn. I wish I had examples for everything, but this one was an easy one. So nerves are about this thick, okay, and they can be this long. Remember, nerves are all the way from your head all the way down to your toes, and the longest one being the sciatic nerve. But let me explain to you what the myelin sheath looks like. The myelin sheath is the covering around a nerve. So let's pretend this is awfully big. The nerves are not this big, but let's pretend that this is the nerve, and then this is the myelin sheath, and it looks like sausages. Really, it's for conductivity. It sends messages, to the muscle, to the muscular system, in order to move for movement. So the sheath is removed when they have a mass, so the nerve is exposed like this. This black part will be all gone. So that's where they start having problems with conductivity. It interferes with nerve transmission, with messages. It's like the electrical wire is stripped. The insulation is stripped. Massage really reduces the pain, and it increases the balance because a lot of times they feel off balance. It reduces anxiety, it reduces depression. Anybody with MS, I'm sure that it's very stressful. And the accommodation would be, again, find out how your client is feeling that day and what kind of massage they need that day, whether it's at a level 3 out of 10 or whether you can go up to 5 depending on where they're at that day. So Parkinson's disease is a neurodegenerative disease, and it produces abnormal movements. It's the one that, where they shake. What that happens is in the midbrain, it starts degenerating the cells, so it also affects the dopamine production. So the client, feels off balance. It's accompanied by depression, anxiety, and their moods. From one minute they're okay, and the next minute they're not. It disrupts their sleep patterns. So it's very important for you to give them a massage that's relaxing, because it really helps them with the balance. It helps them sleep better. It helps to reduce stress and anxiety. So that's about, all that we can do for our clients with Parkinson's. Remember, massage is not going to help neither Parkinson's nor multiple sclerosis, which they call it MS, and these, both Parkinson's and multiple sclerosis, affect the central nervous system. Remember, the central nervous system is pretty much your cranial nerves and, down the center, not the peripheral. Like the myasthenia brevis, that's more of a peripheral nervous system issue. But I wanted to, tell you the difference. So next will be sciatica. And sciatica is a symptom of something else, whether it's from your lumbar area or whether it's from the piriformis muscle. I have a very good video that you might want to look into about, the deep hip rotators, where I do talk about the piriformis muscle it entraps the sciatic nerve. So if it's entrapment, we can help them. If it's the muscle, trapping the sciatic nerve, then we can help them as massage therapists. However, if it's coming from the lumbar area and it's compression, then that's usually from herniated disc or remember we talked in the last one about the bulging disc and the herniated disc. So I brought another example, and let's pretend that this is the sciatic nerve. The sciatic nerve can be as thick as your thumb, so this can be very accurate on a large person. So this would be the sciatic nerve, and it is real long. It comes out from the lumbar and sacral area, and it goes all the way down to your heel. So it can be about 3 feet long, and it can be about this thick. This is the largest nerve in the body, the longest nerve in the body. So this would be the myelin sheath, around it, and then this would be the nerve, exposed right here. So you've got coverings, and depending on whether the nerve is being trapped by the piriformis muscle or being pinched by, herniated disc or a bulging disc, that's something that an osteopath would diagnose. There's nothing we can do about that. And if a client comes in where they can barely walk and they're having a flare-up, more than likely we're not going to really be able to touch them. And there's a test that you can do, the Bragger's test. I show that Bragger's test in the deep hip rotator video. I show you how to do a couple of tests to find out if it's the piriformis syndrome or if it's sciatica, true sciatica. Because I'm sure you guys have had this, where every client comes in and they think they self-diagnose and say, oh, it's sciatica. And the gluteus minimus also mimics sciatica. It refers pain down the legs. So make sure you check to see what exactly, be specific, whether it's the piriformis, the gluteus minimus, whether it's something that the doctor has already diagnosed that they have, a herniated disc or a slip disc. So make sure your client is comfortable. If they're having a flare-up, most of the time sideline position works really well. Make sure that you also stay within the comfort level of the client. If they're having a flare-up, it's usually you keep it like around a 3 or a 4, and in between, If they're not having a flare up and they're okay, you can go ahead and treat around all the glutes, all the deep hip rotators, really release around the lumbar area, the QL, all the muscles around that area will really bring a lot of relief. The hamstrings, the calf muscles. If sciatica's already traveled all the way down to their heel, then you already know it's severe. Most of the time it's local, like around the glute area, but when it starts traveling down the leg, then you know that it's already severe. So, just work the whole leg, the posterior part of the leg, plus the glutes. Really good. And watch that video, because in that video I really explain how to address sciatica. Next will be seizure disorders, and these are explosive, uncontrolled episodes of electrical activity in the brain. So they can lose consciousness. Many years ago we had a student that had seizure disorders, and she didn't tell us that. So all of a sudden she starts having a seizure in the middle of the class. And one of the things that you want to make sure, if this happens with a client, is that you turn them sideways and move their tongue out of the way so they don't swallow their tongue. And this is where their eyes roll back, and it's actually very scary to see. And they feel disoriented for a few minutes after. It's almost like if they pass out. Hopefully it never happens on your table. However, if somebody tells you that they do have seizures, make sure you read up on it a little bit more. I'm just going over very basic information here, so that you can be prepared as to what to do if that ever happens. One of the things that massage does is it really reduces, the stress, the anxiety, depression. It helps with their sleep patterns, which is very important for somebody, that has seizure disorders. So the next one would be the thoracic outlet syndrome. It's the compression of the nerves on the brachial plexus. We have 5 nerves that go through here and branch out. We have the median nerve, the ulnar nerve, the musculocutaneous nerve, I forgot which one I'm forgetting, the radial nerve, and the brachial nerve, and they branch out. A lot of times this happens, I have found, with women that wear heavy purses, and it puts pressure right here on their shoulder. If it puts pressure on their shoulder, on the clavicle and the first rib, it starts compressing those nerves. And then that's where they start getting tingling sensations or numbness to the fingers, and if it's on the pinky side, then that would be the ulnar nerve. If it's on the thumb side, that's the radial nerve. And so you've got to do some investigating, and you want to make sure and treat the scalenes and the SCM, and the pectoralis minor also is known as a nerve entrapper that traps, some of the nerves that go through there. So make sure that you know which muscles to work and what position to put them in, so that they can be comfortable, because thoracic outlet syndrome can be very painful. So if they've seen a doctor, make sure that they tell you what they found, and if they haven't gone to a doctor, make sure you refer them. We got to stay within our scope of practice. However, you can really help them to relieve all the muscles, relax the muscles that might be pressing on that nerve. So they'll be very grateful if you can do that. Next one will be the trigeminal neuralgia, and the trigeminal neuralgia is nerve number 5 around here. It has 3 branches, and the trigeminal neuralgia can be affected by all 3 branches. It can be triggered by hot foods, cold foods, by brushing your teeth, by shaving. It's excruciating pain when it's severe. It's very, very painful. I've known of people that, it has been triggered by dental work, by the way they position, they open their mouth. It could be affected. I know it even, actually it affected my son too, when he got hit in the face by a bull, and he broke his zygomatic bone, and it affected the nerve. So you want to avoid the prone position, especially putting pressure, in that face cradle. They cannot handle any pressure here. If they're having a flare up and they can't handle any pressure, then just avoid the face area and put them supine or sideline. If they can't go face down, if it's really bad and severe, you might want to put them sideline and avoid the area. If it's not too severe, then you can work the masseter and the pterygoids and the zygomaticus and the SCM according to what's going on with the client. This is why it's so important, guys, to really spend a few minutes with your client as soon as they walk in and they fill out the form of how they're feeling that day. I always ask my clients, what can I do for you today? And they usually tell you what they need or where, and then it's your job too to ask them a little bit more questions of how they're feeling that day and what would be the best way to approach their therapy that day. So that is it for the pathologies for the nervous system, the migraine headaches, multiple sclerosis, Parkinson's disease, sciatica, seizure disorders, thoracic outlet syndrome, and trigeminal neuralgia. And guys, I am very aware that you can't see this because of the reflection. I'm working on how to change the background maybe to black, and that way the letters will stand up more. It's all a work in progress. Probably by the end of the pathologies, I'll get it right. So hang in there with me, guys. I just hope this helps you. It's a quick review. Like if you're going to take the MBLEX and you need a quick review at least to know what each is, then you can, go back on these. But the next one I'll be doing next week. And I think it's the endocrine system, which is another difficult one. So until the next time, create a great day, guys.